Hello, good day everyone. Welcome back to my page. I am NurseFelly. Please like, comment and share. Today's topic, I will be talking about undistended testes. And undistended testes, before I go further, testes is part of the male reproductive organ, and in some children, especially babies, after the delivery of the child, they will discover that the testes did not distend into the scrotum sac. Sometimes the doctor will try to manipulate the testes manually to put it in the scrotum sac. The testes is like a small ball. It's not as big as this thing I'm holding, but they are two in number. It's normally at the scrotum sac. But in the case of these babies, most times you find out that the testes will be hanging. So sometimes they do a manual process to put back the testes in the scrotum sac. But if the manual process fails, they will give the mother an appointment to come for a surgical procedure whereby the testes that refuse to descend into the scrotum sac will, through the help of the operation, they will put the testes into the scrotum sac. And this needs to be done within 6 months after the delivery of this child. What do I mean? Doesn't mean that the child need to stay 6 months. Depending on the assessment of the doctor, there is sometimes a consultant that will do that. On the urologist will do that. They will examine the child and they will give the parents an appointment on when to come for this particular surgery. Somebody will be asking, is it necessary? Child is too small. Why would they do such kind of procedure? It's very, very important. Because if that procedure is not done and the child is growing with an undistended testis, there is a possibility that that child will be sterile for life. That child cannot impregnate a woman, because the testis is part of the male reproductive organ that help in the production of spermatozoa. If a male cannot produce sperm, what will he release to the woman so that the woman will be pregnant? So please, as a parent, as a mother, or as a caregiver, after the delivery of your child, please examine the male reproductive organ. If you notice that the testis is not in the scrotum sac, or you don't understand why the testis, there is a way the testis is looking different from other children that you have or other children that you have seen, please take this child to the hospital for a special examination by the urologist. They will decide on what to do, and if it is if the testis in the scrotum sac, they will let you know. If the testis is not in the scrotum sac, they will also inform you. Sometimes they can even do an ultrasound for this child, and it will show where the testis is located. And if there is need for surgical operation to put the testis in the scrotum sac, you will also be informed. Thank you. Please like, comment and share. Bye.